So, miigwech and merci beaucoup, and thank you for joining us today for our Lunchtime Health Sciences webinar on a new resource for fieldwork teaching and learning in OT private practice, delivered by Donna Barker and Shone Joos. I'm Jen Baker, and I'm the Programs and Partnership Coordinator here at NOSM Universities. So we'll do a little bit of quick welcome and introductions. So a reminder about your microphone being off for the duration of the webinar. The webinar is being recorded and will be posted to our YouTube channel in the future. If you have any questions throughout the presentation, please feel free to take yourself off mute and answer them. It's a small group today, or feel free to put them in the chat. We will moderate that throughout the presentation. And at the very end, Shone and Donna will answer any questions you may have. All of our previous webinars are now on YouTube, and you can find those links to those recordings on our RS and NoDip websites under the resource section, or you can find those webinars directly to our NOSM YouTube channel. So in the spirit of truth and reconciliation, NOSM University respectfully acknowledges that our pan-northern campus is on the homelands of the First Nations and Métis peoples. The university buildings we occupy in Greater Sudbury and Thunder Bay are located on the territory of the Anishinaabe Nation, specifically Atikameksheng and Wahnapitaea First Nations and Fort William First Nations. Beyond a land acknowledgement, we understand that reconciliation is a practice. We gratefully acknowledge the elders and knowledge keepers who share their gifts and teachings with us so that we may better understand and honor their wisdom and that of all of the traditional keepers of this land. NOSM University will continue to practice reconciliation by listening, learning, and fostering a culture of mutual respect and trust. Our first speaker today is Donna. Donna is an associate professor in the teaching stream of the Department of Occupational Science and Occupational Therapy at the University of Toronto and was the department director of clinical education for 15 years. Previous to her 2006 appointment at the university, Donna worked for 20 years in the healthcare system as a clinician and occupational therapy practice leader. Donna's research interests include student accommodations and clinical education, innovation in clinical education within private practice. We also have Shone Joos, and Shone is an assistant professor in the teaching stream in the Department of Occupational Science and Occupational Therapy at the University of Toronto. Shone has been involved in teaching as a guest lecturer and facilitating labs within the department since 2003. Shone was a member of the Fieldwork team from 2017 to 2019. Prior to her employment at the university, Shone worked for over 25 years in the healthcare system as a clinician, educator, researcher, and OT practice leader in both a large rehabilitation hospital and community-based settings. She also operated her private practice for almost 20 years, providing service to infants, toddlers, and school-age children. Merci beaucoup, miigwech, and thank you. Donna and Shone, thank you for your time today. We truly appreciate you sharing your knowledge with us and very much looking forward to the talk and the opportunity to ask questions. I'll now pass things over to you.
Great. Thank you so much, Jen. Shone and I just really appreciate the opportunity to be here today, and thank you so much for your participation with us. We just look forward to presenting to you, but then also hearing from you. Sorry, I'm just going to share my screen here. Hopefully everybody can see it okay. Okay, great. We do consider it a privilege to be here, and thank you again for joining us. If any of you have any visual difficulties, I am a white middle-aged woman with chin-length blonde hair and glasses. I say middle-aged, but then I thought, you know what? I do get the Shoppers Seniors discount, so take that in mind if you can't see me. All right, Jen has already read the NOSM land acknowledgement, but we would like to share with you the University of Toronto land acknowledgement. We wish to acknowledge the land on which the University of Toronto operates, For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Shone and I would just like to know a little bit more about you that have come today to join us on this webinar. And so we have a Mentimeter poll, and there's a couple of ways you can get to this. I think in the chat, Shone has posted a link. You could also just type in www.menti.com and use that voting code, or you can actually just scan your screen if you have a QR code reader. I believe there's just like 3 questions on there. And so Shone will give you a minute or 2 just to enter your questions, your answers to the questions in there, and then Shone will unmute and tell us who is here and how the questions were answered. If anyone has any troubles, just let us know. You can unmute or put something in the chat.
Okay, Donna, it looks like we have 4 OTs, 2 physios, and 2 other professional background experts here with us. And we have 2 in hospital-based care, 2 in publicly funded community care, 1 in group private practice, 1 in sole private practice, and 1 in mixed practice, both public and private. And then 4 of you have had between 1 and 5 students previously. 1 of you have had 6 to 10 students, and 3 of you have had 11 or more students. So that's fantastic. Thank you so much.
Amazing. That's actually really helpful for us to know as we go through, and exciting actually also for us to know. So thank you for participating in that. I believe these session learning objectives were made available to you beforehand, but I'd like to just go through them again as we begin the presentation. So by the end of the presentation, participants will be able to describe challenges related to OT fieldwork teaching and learning in the setting, be able to state reasons why it is important and beneficial to have OT fieldwork learning opportunities in private practice, and also describe how the private practice fieldwork model facilitates fieldwork teaching and learning in OT private practice. And so the private practice fieldwork model is this new resource that is mentioned in the title of this session. We're going to refer to it as the PPFM throughout the presentation. And although the PPFM was specifically made for OT, we do believe that it can be adapted and utilized in other professions. As we know, we have a physio online here and a physio student, and we have also others from different professions. We've had interest stated in it. Right now, the resources are specific to OT and specific to Ontario. But as we say, if it would be helpful, they could be adapted for other disciplines. Just as far as the format of what we're going to do for this session, I'm going to just be speaking to you for the next 10 minutes or so on the foundation and research underpinning of the PPFM. And then I'll pass it over to Shone, who's going to describe more specifically what's in the PPFM and how it works. And then we'll have questions, as Jen mentioned, at the end. We have a couple questions for you, but also very open to having you ask us questions of clarification or anything like that. So before we go any further, we just want to make it clear what we're talking about when we say private practice. So this is our definition for our purposes: organizations or individual occupational therapists that provide services that are outside of the publicly funded healthcare, education, or social service systems. And so this could be private practitioners who provide services to third-party payers such as WSIB, automobile insurers, casualty insurers, extended health benefits, lawyers, employers, or they may be paid directly out of pocket by individuals. For the purposes of this presentation and also the PPFM, we also consider private practitioners those that contract their services to third-party agencies that provide publicly funded services. Click on the right. As fieldwork faculty, we're always striving to provide clinical learning opportunities in a wide variety of practice settings. We strive to just get as many as possible, and we've always had difficulty with the private practice setting. We don't have as many placements as we would like and as what the students would like. We know from CIHI data actually that about 25% of OTs in Canada work in private practice, and so we're very concerned that we weren't providing very many students with opportunities to have exposure to this practice setting, but also to start developing the skills and competencies that they needed in order to work in this area. So we knew that we'd have to do some research and try and figure out why this was the case and to see whether we could make any difference in this. We did, of course, look at literature that was already out there, research that had been done, but it was older and we just weren't sure if it was still relevant or not. So what we decided to do is do an Ontario-wide research project, a study that looked at the challenges for private practitioners to taking students on fieldwork, and then also look at solutions and what their suggestions were for solutions in taking students on placement. So in 2012, we did conduct a study across Ontario. We were very fortunate that our regulatory body, CODO, helped us with recruitment for that. And we were able to recruit 247 OTs in Ontario who worked in private practice as participants. They represented varied funding sources. 42% of the participants worked 10 plus years in private practice. 60% were self-employed. And this surprised us and didn't surprise us. 79% of the respondents had not taken a student on fieldwork in the past 5 years. Just as an FYI, in 2016, we actually did a Canada-wide similar survey. And again, we were very fortunate that the regulatory bodies across Canada, the different provincial ones, assisted with recruitment. And we did a similar study. We had to make some changes slightly, and we also translated it into French so that we could include those who were French speaking, and looked at this across Canada. And we had 352 OTs who worked in private practice in Canada. And the results were similar. There were some regional differences. Interestingly, Quebec actually has a lot more placements in private practice than representatively than anywhere else in Canada. So it was very interesting. We did create the PPFM in 2015 and based it on the 2012 results because that was specific to Ontario. But we do believe, because the results were so similar in the Canada-wide survey, that it would be helpful for other provinces if it was adapted to their legislation and any differences that might be province to province. We've listed here 2 articles that actually have more information and results and discussions of the 2 studies that were done. So you're welcome to have a look at those if you'd like to. This slide shows the results of the Ontario study. And we're going to look first at the left-hand column, and this is representing the challenges that we listed to the participants in the study is this a challenge to providing fieldwork placements for you? And you can see from the bracketed percentages there that all of the challenges that we presented to the participants were verified and validated by these participants, right from 60% up to 87% of the participants agreed that these were challenges. So let's just read through them here. Challenges were fluctuations in caseload and time, lack of physical space and/or resources, concern regarding the student capability to succeed on the placement, costs associated with student supervision, liability issues, uncertainty about effective student teaching, concerns regarding client satisfaction if the students were involved in assessment and treatment, similarly, concerns about the quality of care that the students could provide, concerns around the legal aspect of things, and the fact that they have a lack of involvement in student selection and who came to the placement that they would provide. If we look at the right-hand column now, this is the most frequently chosen strategies related to each of the challenges. So the participants could choose different strategies. These that you see in the right-hand column are the most frequently chosen strategies for that particular challenge. You'll notice that for 3 of the challenges, joint placement was most frequently chosen. And just to give you a definition of that joint placement, it means the definition we gave them is the student's time is shared between 2 therapists or between a therapist and a university faculty member. The other thing that you'll notice on here is that augmenting the curriculum or student preparation was chosen 4 times as the most frequently chosen strategy to combat the challenge. And the other suggestions were most frequently chosen just once, and that is increasing the honorarium and involvement in student selection. So here's a summary of the study recommendations to increase fieldwork learning opportunities in private practice. And I'll say this is based on the quantitative results, the summary of which you just saw, but also on the qualitative comments. And it was interesting because there were almost 1,000 comments from these practitioners on this study. So they had a lot to tell us and a lot to share with us. So here's the main study recommendations then. Joint placement was obviously right up there with being a strategy or a solution. The preceptors, or sorry, the participants really needed to see flexibility of the student time that they would have with the preceptor, knowing that fluctuations in caseload, knowing that they might be losing money when they spend time with the students, etc. The participants also felt that they needed more incentives to provide student placement, so honorariums or other rewards to really counterbalance the income loss that they might experience in having a student. The participants wanted the students to complete a project, something that would be a give back sort of thing to them and or the organization. And interestingly, you know, most participants didn't feel that connected with the university, and so they felt that they needed more instruction on the best way to teach the student clinically while they were on placement. So suggested something like a preceptor handbook or a workshop. And they also wanted to ensure that there was a lot of university support during the placement, especially if the student started struggling on placement. They wanted involvement in student selection to ensure that the student would be an asset and that they would have the skills. And even they talked about the personality, being a self-starter and those sorts of things for the practice setting. And last but not least, certainly very important, is the recommendation that there be increased student preparation in various areas. And once again, we had made some suggestions to them of ones that they could choose with increased student preparation if they thought this was something that was necessary. And they chose these, but also had opportunity to add. So these areas were report writing and documentation, legal and ethical issues in private practice, legislation governing the sector in which the practitioner practices. They felt that students needed increased preparation in how to conduct assessments, including vocational assessments. The students needed more preparation in terms of neurocognitive rehab and other hands-on skills, anatomy, biomechanics, ergonomics, and mental illnesses. I am going to, I'll just talk with you briefly before Shone comes on to mention to you about how we did base this model on those research results. So first of all, we did say, okay, this is going to be a team teaching opportunity, this PPFM. It's going to be this joint placement idea. So the people teaching the student on placement will be the OT working in the private practice, the preceptor, but also the university faculty. And we use core faculty, but also status or adjunct faculty who are practicing clinicians. One other thing to note is that we do make workspace available for the students and the preceptors at the university if it's needed, because that was also very clear that many of them just, if they worked out of their homes, etc., they needed spaces for the students and wanted that. Shone's going to talk a lot more about this, but if we look at how the student spends their time then, and this particularly with these percentages are more in the first half of the placement, but in-person learning with the preceptor would occur 50% or more of the time. About 10% is hybrid lab learning at the university and online. Up to 40% is online learning through module completion. And then depending on what the project is, there's independent clinic-specific project work. This is the win-win, make it valuable for the students' learning, but also for the preceptor and the organization. So Shone's going to walk us through the PPFM and tell us a little bit more about it. I can't mute myself because I'm on this presenter mode, but I promise I'll be very quiet.
Thank you so much, Donna. I'm so excited to be here and see all of you this afternoon. So thank you very much. This is a fantastic resource which Donna has spearheaded at the University of Toronto, and I'm really glad to be a part of it. The PPFM uses the online U of T very robust platform called Canvas, which if you've taken any online classes, you might be familiar with, but all the information is based there, and that's where all our students obtain all their course materials. And we have a number of modules. We have preceptor modules, student modules, and then we have modules related to possible university labs. In terms of the suggested timeline, we've developed a suggested timeline as you see here. And each week, students engage in online self-directed asynchronous modules independently. And they also can participate in various labs when this is possible and supported by the students' university. The students also participate in online discussion boards each week. And all of this PPFM work can be done at the student's home or another preferred location if you have a clinic space, etc. This timeline is very flexible. We've just provided you with a guideline here just so you can see how students progress through the program. And the rest of the time each week, the student is working directly with their preceptor, observing or participating when possible in indirect and direct client care. Here we have week 1 specifically. So in addition to engaging in that online discussion board, students would complete the first core module, which is the introduction to private practice. Here they're going to gain a basic understanding of what private practice in their field looks like, Obviously, this is specific to OT currently, but I think that there's room for growth and adapting to other healthcare professionals. They would learn about the medical legal aspect, clinical community care, and consulting contexts. They would be able to start to understand the differences between being an OT in private practice compared to the public sector, and gain a basic understanding of the different roles that an OT would have in private practice, being self-employed versus working in a clinic private practice company. They are also exploring the regulatory standards and guidelines related to private practice. Once they've completed Module 1, they move on to Module 2, which is consent issues related to private practice. And they're really learning to understand what informed consent is, how to identify indicators of informed consent. They're reviewing regulatory guidelines. They're gaining an understanding of confidentiality in private practice and some of the challenges with that, how to document informed consent, and how to apply their knowledge of consent issues in private practice to various case studies. At this time, the lab of interview skills lab might be appropriate here for week 1, and this could be available depending on whether or not the university is able to run it. In week 2, there's a core module, ethics issues in private practice. So students are starting to learn to describe and differentiate between different types of ethical challenges that you would see in private practice settings. They're going to learn to apply the principles of the decision-making framework, which was developed by the OT College. They're going to learn about various factors, core values, and principles that would help guide their decisions, and gain an understanding of the relevant legislation, the practice guidelines, and the standards around ethical issues. And they'll be using case studies to help them work through these skills. And then in week 2, they can complete the core module 4, which is health and safety in private practice. So they're learning to identify basic infection control guidelines, things like hand hygiene, cleaning, therapy supplies, COVID-related prevention. They're going to be able to identify basic community safety practices for physical, psychological well-being and safety. They'll be using case studies to work through this, and they'll be reviewing standards for infection prevention and control. In week 2, another possible lab that would be appropriate here is the application of theory and models of practice. So students could work together in pairs or within their university or across their university, depending as it's appropriate, to complete learning activities, and then they could submit a video of their work to demonstrate their skills and abilities. In week 3, they have a module on business practices. So they're learning to understand various business aspects of private practice, things like liability insurance, business costs, storage of documents, etc. Be able to understand the appropriate use of title and scope of practice, various considerations for business practices in different practice settings, and be able to clearly identify ways to advertise or promote their services, as well as those advertisement restrictions. They'll also be able to have a good understanding of relevant legislation, practice guidelines, and standards surrounding advertisement and the use of social media. In week 3, they can take on some additional optional modules. Now this can be discussed between the preceptor and the student as to what their learning needs might be, and as well to be participating in an online discussion board. At this week, they can also start their project work, so they can start to help you with developing some evidence-based best practices or supporting you in using outcome measures in your practice, etc. And I'll talk about some of the projects a bit later. And during week 4, any of the applicable optional modules are available to them. They are participating in their discussion board and the project work, and you'll see that there's a variety of optional modules such as record keeping and documentation in private practice, legislation affecting private practice in the auto sector specifically, telehealth, mental health in private practice, billing in private practice, and WSIB and return to work. In weeks 5 to 8, preceptors and students would negotiate what additional optional modules that they would do, if any, and they would participate in the discussion boards as well as the project work. But the majority of their time in weeks 5 to 8 is providing direct and indirect client care. So this is the actual PPFM housed on our U of T platform. This is the landing page. This is where students and preceptors would come to access any of the modules, any of the learning activities, or the labs. You'll see here is the list of all the core modules and all the optional modules that the students and the preceptors could both access. And this is where all the learning activities are housed. Here is an example of the very first core module, Introduction to Private Practice. So you'll see that the students would work through the activities in order, and they would complete these independently. And each module has a case study to help the students deepen their learning. Here's an example of the case study from the core module 2. And these and other case studies are actually used with permission from the College of Occupational Therapists of Ontario. Here's an example of some of the learning activities that you might find in these learning modules. Here we have a video of 2 private practice practitioners, one of them being myself, talking about the challenges and rewards of occupational therapy private practice. So students would watch these modules and then reflect on them and do an activity. And finally, each core module has a final activity, so the students would independently complete this and submit this online. Here's an example of the discussion boards that would be available to the students. So each week, students would participate in a discussion board that can be set up and monitored by the university involved, and students can pose questions. They can pose questions and engage in discussion with each other. They can share resources, etc. And then, as I mentioned, we have currently we have 2 lab activities which can be set up. This can be done, excuse me, in person, or it can be done online. The first lab is the interview lab. So students get an opportunity to learn different communication skills relevant for interviews. They work through a variety of case scenarios that are applicable to private practice, and they learn to practice advocating for OT role in their client. The second lab is the clinical reasoning lab. So students would practice the application of theory and models of practice using various case scenarios, and they would learn how to create a treatment plan for their client using the clinical reasoning and guided by at least one OT theory or model. This would be worked in done in conjunction with scenarios from the private practice that they're actually working in. And of course, we also have resources for the preceptors. So students are welcome to review these as well, but we have specific information to support the preceptors and who are actually providing these fieldwork experiences. There are many benefits to being a preceptor. Taking on the role of clinical instructor is definitely a commitment of energy and time, of course, but many preceptors have reported to us that they feel that it's an extremely rewarding experience to teach a student. They've learned many things themselves, and the college formally recognized fieldwork instruction as professional development. CAOT, OSAT, and the college also all support and encourage OTs practicing, even in private practice, especially to take students out in fieldwork, as this is a growing area. Some of the things that our students can support you with are, the students are engaged in research at the university. They have full access to the U of T library, so they can assist you with the development of evidence-based care resources. They can do literature researches for you to help you hone best practices with your client population. Students can also assist in marketing your private practice. Students in the past have assisted with creation of brochures for clinics, developing websites, other materials. We've had students create and run free community events that were run out of a clinic. Some of the student placement time can be spent doing these kind of activities. Students can also perform or assist with, doing a customer or referral analysis, so you can better understand where your referrals are coming from, or you can help nurture and develop these relationships. Students could create things like a physician survey or do a kind of an environmental scan of your local area, better understanding resources that can be provided for your clients. Students can also perform a review of your personal or your company record keeping protocols, your client documentation. They can help you check compliance with the regulation using something like the CODO's record keeping review tool. Some OT private practice companies have also used students to augment services, with the introduction of summer camps or extended treatment sessions. So there's a number of examples of projects that students have been involved with while they're completing the PPFM. So we hope you will all consider how the PPFM could be useful to you and support you in taking on future healthcare students. And we look forward to continuing this work together. We have some questions for you. We would love to better understand if you can see the PPFM being helpful to facilitate fieldwork teaching and learning in your practice sessions. And I would love to know if there's any other learning modules that might be helpful to you. And if you'd like to be involved, we put our contact information there. Thank you so much. I see Mike has a question. Donna, I wonder if you have the answer to that.
Maybe I don't see what the question is actually, because I'm in presentation mode.
Mike was asking, have we tracked the average time that it took students to complete each of the modules or even the components?
Yes, we have done that. And it really varied. Some of them said it took up to 5 hours to do a module, but it would really depend on the module, and it would depend on how deeply they went into some of the activities. And I have to say, Mike, the other thing is we have changed some of them. Like you can imagine, we developed this in, like 2015 to 17. And had students using it in 2017. Well, now we have the pandemic and everything else, and CODO changes their resources and OSHA changes their resources. And so we've changed things up. So as for currently how long it would take, I'm not sure. We want to do, I am retiring, but Shone, I'm so excited. Shone is excited about the PPFM, and she probably knows it even better than I do because she has been the facilitator and mentor for many students using the PPFM and has all the private practice experience, whereas I have none. So we will continue to be developing these modules and continue to try and keep them up to date. And that means we can't always predict how long those modules are going to take for the students.
And you can really tailor it to what the needs of your student are. So if you feel like, you have 3 days where there's full clinical experiences available, and then you want to have the student work on the PPFM activities for 2 days to ensure they have a full week, then you could set it up that way. So it's very flexible.
That's great. Thank you very much, Donna.
No problem.
I'm sure that there are some questions of the attendees. So I have a few other questions and maybe more logistical questions related to if people would like to be involved in trial this with a U of T student, but I'll save those for the end. See if other people who maybe don't have time to stay right to the end have some questions.
Okay, thanks, Mike. So with that invitation, anyone can unmute and ask a question or put it into the chat box, but someone would have to make me aware of what's in the chat box.
I sent a question. Are these modules only available to U of T students?
Excellent question, Lise. So at the moment, that is the case. However, we do have interest from other Ontario universities, and one thing Shone and I are going to try and do within the next couple of months is make this much more available for the other universities. The way we have it now on our learning system, you actually need to log in with a username and a password, and the username has to be a University of Toronto ID number. So we have to temporarily assign someone a UTOR ID, we call it, and then a password, and give you access to the course for a certain period of time. And we can't make it more than a year, for example. So what we're trying to do, Lisa, is make it available to everybody by opening it up to everyone. Before we do that, we want to, we've been working on trying to update it, and we need to work more on that, but we hope within a couple months to have it available for anyone to use. And at that point in time, you know, we could send it to Mike or Jen or whoever it is and say, okay, here's the link, you can use it. Now, of course, you'd have to discuss, like you really, we would have to make it so that there's no discussion option. We have to look at things like that, right? And putting in those assignments, like if the student is submitting assignment, it's not for everyone to see. So we just have to figure out those types of details, right, to make it user friendly and the way it should operate.
Lisa, if you want to email us, we'd be happy to connect with you and work with you, because there is a way to, you know, provide temporary codes and passwords, and maybe that's our first step once we've updated it. So yeah, it'd be great to connect.
Thanks. I do have a second question, but I don't want to hog you guys. I don't know if you've thought about this, but you know, a good incentive for private OTs maybe to have a discussion with CODO to see if they can get any like CEUs or recognition for supervising a student, because that might appeal to them. It might not be a financial gain, but you know, it would help with their college, you know, and their requirements with the college. So it's just a thought I'd throw out there if you haven't done it already.
Yeah, Lisa, we've definitely been in conversations with the college at various points in time. And I will say that the college does ask it on the renewal, like, have you taken a student? It is considered an aspect of professional development. So we can continue conversations with them. But I know even across Canada, the fieldwork faculty from the different university OT programs have always been in touch with their regulatory bodies to promote fieldwork, because it is professional development. And I have to say proudly of CODO that they've been the most responsive and ensuring that that message gets out there. OSAD, of course, is also a great promoter of student placements. So really appreciate your comment, and we will continue to be in conversations with them. I'm actually finishing a final term on the board of directors of CODO. So I sort of have a little bit of an in of what's going on there as well. So thank you.
I see, Brock, you have your hand up.
Yeah, similar to the last question, and I'm not sure if you mentioned this or not, are these resources available to the physiotherapists? And maybe you covered that and I missed it.
Yeah, great.
Yeah. Go ahead, Donna.
Yes. Oh, sorry. Shone, you can chime in. But definitely we've had interest from physios, but right now it's so geared, like when we have the resources, it's all the College of OT resources. Of course, legislation would be the same for Ontario legislation. So some of the things, but and case examples might work as well. We'd really have to have a look at it. But Brock, as you can appreciate, we would need a PT champion on this, because we are not PTs, and as we've relied on the research and the OT research, the first step might be to conduct some research, either formally or informally, to see what is needed, as we've really geared the PPFM to the research that looked at OT in private practice. I don't know if you have anything else to add, Shone?
Yeah, and if you're interested, it'd be interesting to have a connection. Feel free to reach out, because I think that there's room for growth here, and I could see it being adaptable to supporting the education of physio students.
Okay, thank you, and great presentation. I'm not an OT, as you know, but certainly my brain was going in all directions as to how this would be valued in the physio world. So yeah, I think that there's definitely room to move forward to extend it. So thanks again for this great work. And
specifically, the modules on consent is not going to be different, or the module on introduction to private practice is not going to be different outside of maybe some specific specificities around the practice setting. But there are a lot of similarities on learning about insurance, learning about business costs, so there's a few modules that I could see having a pretty quickly adapted for those students.
And I will say, Brock, that Shone and I, some of the private practice organizations that we've been working with, like Functionability and CBI Health, certainly in the Toronto area, have developed some of their own learning modules. And I bet a lot of them are multidisciplinary, like whoever, I'm sure they would be applicable to PT as well. So we know someone at the Functionability and might be able to, sort of take some of those modules. I don't know, but it's something that we could definitely look into, but we would definitely, as I say, need a PT champion to do the work with us on that. Some other questions? Or are we going back to Mike again?
I can ask one quick question in relation to like the way that your presentation flowed today. You spoke about some studies that you did that provided the rationale for it, and you designed it based on what you found, which is fantastic. Has there been any evaluation, follow-up evaluation of the success, if it's actually helped mitigate some of the challenges that you've based it on?
Yeah, we did have in 2017 a survey of those that had used the tool. Unfortunately, we didn't have big uptake on that as far as students. We had a survey for preceptor and a survey for the students that utilized it. It was all positive, I have to say, but we learned things like you have to be more flexible. Like the students were saying, yeah, I was told during week 2 I had to do these modules and it took up too much time, so I missed seeing this client. And I really would have wanted to see this client. Or you set the lab at this time and this day, and it meant I couldn't have this learning opportunity with my preceptor. And so we learned about having to be much more flexible. They spoke about the value. We asked them the value of each one of the modules. We asked about the value of each one of the components, like the videos or the resources. And so we got information from the students and the preceptors. The preceptors generally liked it, but we only had response from 4 preceptors, I believe it was. And so obviously the people, those preceptors were ones that were willing to try it. We did ask them, would you take a student again? And they said definitely, utilizing the PPFM. So we have very limited data. And I have to say, even though we started this in 2017, we actually had a built-in survey that we wanted the students to complete when they finished the PPFM. And it wasn't really done. Now, part of our problem is the pandemic. And as the pandemic came, we did not sort of formally run the PPFM. And what we did is we just gave everybody access to it, all the students, etc. We didn't have personnel like Shone previously, facilitating that PPFM. And so we're trying to get back on track again. But to answer your questions, I think it has helped some private practitioners to provide more fieldwork placements. We do have more private practice placements than we did. Now, whether some of that, Mike, is even just because they know we're wanting more and that we are very respectful of this being a challenging area, and you know, just more awareness on the university's part of wanting to make those connections.
That's great. And one recommendation, I guess, to consider, without having gone through it myself, but if it's not set up this way, to actually maybe even have the evaluation come after each module and it be a requirement.
Yes, right. I'm writing it down, Mike.
Love that innovation. That's great.
And a follow-up question would be, again, for any OTs who are watching it now or perhaps going to watch it afterwards when it's in our archive. We spoke when we met in December to talk about this webinar. We spoke about potentially trialing it with some U of T students at some point in the future who would get kind of the full experience within the way that it exists right now. When typically are the private practice placements for U of T students?
Yeah, they can actually occur during any of our placement blocks, Fieldwork 1, 2, 3, or 4. The majority, I mean, probably the most, because we consider them LEAP placements, would occur during Fieldwork 3 or 4. We found that, like, even the use of the PPFM at different levels of student fieldwork learning is an interesting question, because when, even in the study, it seemed that if you have a Fieldwork 1 student out there, a level 1, they're doing a lot of observation. There's not as much expectation that they'll do aspects of assessment and treatment. We do want client involvement, but it's not usually independent. Whereas when you're looking at Fieldwork 3 or 4, you're hoping that the student is able to do some independent work. And thus they wanted to be sure to use the PPFM so that the student really understands things and are at a more advanced level. So really, the PPFM is opened up to any private practice placements we have, and we do have them during Fieldwork 1, 2, 3, or 4. But Shone could maybe comment on this. She has run the PPFM with the labs and the discussion things, I think, Shone, only during Fieldwork 3 and 4. Is that correct?
That's correct, because we found that the more advanced placements, they were able to, you know, have those experience of obtaining consent, for example, independently, and then they would be able to bring that back and we'd have more discussion, or doing the interview lab, and they would have those experiences where then they're going out and using those skills independently versus just observing. But it is pretty flexible, and so it can be done, you know, for a student at any level of fieldwork.
Thank you. And Shone, I'll just comment on your question that you posed. And I think this is important, again, for not just people here, but for the recording as well. If any clinicians have ideas for other modules that'd be useful for private practice, so they can connect with you and Donna up until June, and then just Shone afterwards.
Yes, that would be fantastic.
And that's how it developed. It developed out of a need, and we would love to hear, you know, see, you know, what you feel would benefit your students when they're starting or when they're, you know, engaged in their fieldwork experience with you.
And I have to say, we just, especially for someone like me who doesn't have private practice experience, when we developed this, We asked in the Toronto area what private practitioners would want to be involved in the development of the PPFM, and we had 26 private practitioners in the Toronto area want to help with this and help to develop these modules. So really excited to have that, and really appreciate anybody who can help us out with this, who has that experience.
Well, thanks, Donna and Shone. I know Tyler jumped off. I was going to suggest, I know he's taking a Queen student coming up very, very soon. So I thought, oh, maybe, but he jumped off the call. So, yeah.
Yeah, that would be great. We'd be happy to connect, and excellent.
I'm not sure. Is there any other questions? Like, did you ask all of yours?
I did, yes. Thank you for tolerating my questions. And Lisa, I'm glad you joined us today, because when we were talking with Donna and Shone in Toronto in June, I immediately thought of yourself and that you might have some interest in this.
Well, thank you to all of you. That was great to have the chance to share with you, but also to hear from you.
Yeah, absolutely. So again, we want to say thank you on behalf of all of us at NOSM University. It was really well done and very informative. So thank you very much.
Thank you. Glad to be here, and wish you all the best in 2023.
Absolutely.
Thank you so much, everybody. Have a great day.